one of the biggest challenges for anybody else thinking about doing such a thing is we really need a glossary of terms. I mean, we talk acronyms and very familiar with our own language, and boy, that's been an impedance. That's something we spend a lot of time just teaching them, and it's embedded in the language that's in our data as well as the way we communicate with one another verbally. So that's been a big challenge for us, actually.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite, and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
On this episode of Power Supply, we speak with Ed Hisscock, Senior Vice President of Supply Chain at Trinity Health. Gary, this is the second appearance on Power Supply. He's also been on the ARM SME podcast, and Ed puts an enormous amount of effort into improving the industry. He's an innovator, an entrepreneur, and as you'll hear today, he's a builder.
I can't wait to hear what he has to share today. He has got a wealth of knowledge, expertise. I'm curious to see what he's going to be launching very shortly. And this year, I've heard some little bits and pieces, so I'm curious to see what's going to happen. Big time effective in our ARM chapters. I hear that a lot, and I just can't wait to hear his knowledge and where he wants to go with this on building a legacy. I'm hoping to hear lots more as he gets going.
All right. Ed Hisscock up next, talking about student engagement to achieve a sustainable talent future. Stay with us. We'll be right back. Bam!
I'm Hayes Walter.
This is Gary Skinner.
And I'm Justin Poulin.
From the studios of Healthcare HQ, you're listening to Power Supply.
Today we have Ed Hisscock, Senior Vice President of Supply Chain at Trinity Health, back for another episode. Ed, this is your second appearance on Power Supply, and you've joined me on the ARM SME podcast as well in the past. So you are now a veteran of podcasting. How's that feel?
It feels good. You guys do a great job.
Well, thank you, Ed.
That's subjective. That's a rather subjective, though, Ed.
I think our guests do a great job.
Absolutely.
Exactly.
Absolutely.
Well, speaking of really great work, Ed, I've had a lot of conversations around the topic that we're going to be discussing today with the Power Supply Advisory Group. And it's how do we engage students to really fill this pipeline of new talent into the healthcare supply chain, really align them to the mission of healthcare. That one was for you, Gary, and create a sustainable talent future. And so you've got some really great updates and some plans in the works that we're going to be sharing today, which ultimately is going to lead to a playbook that many of the ARM chapters out there can leverage. And, I'm interested in hearing how you're already doing this and why you're sharing that with the entire industry so that we really kind of lay a foundation for the future. So welcome back to the show. And Ed, for anybody who hasn't tuned into your prior episodes, maybe they're a newer listener, can you just talk about your background, like your career? You've really accomplished a lot.
Oh, I've been really blessed. Thank you for asking. I started out actually in healthcare in clinical engineering. So
Biomed, baby.
Yeah. Biomedical engineering, fixing equipment in clinical laboratories. Did that for a little company called American Hospital Supply.
Oh, yeah, a little
company back in the day.
Yeah.
Pulling the strings.
A few entrepreneurs out of that organization, right? But I actually worked for the SP, Scientific Products Division, and just was fascinated with this industry. I had been in telecom prior. My first degree is in electronics. So as I got into the work and really started to understand all that healthcare is and the purpose behind what we do for a living, right, on the provider side, just really got bit by the bug and have not looked back since. I have experimented with a lot of different roles over the years. So I spent that time with SP, became Baxter through acquisition, left that organization to provide some interim leadership in a provider sector and supply chain. That was with an organization called Mercy Health Services that later became Trinity Health. And then I left Trinity after we merged with Holy Cross to become Trinity and started and sold a couple of companies. So I started a consultancy, a little different in that we didn't do project work. All we did was just interim leadership, trying to break that consulting cycle so that we would move in and actually be the leader for a period of time, grow and mentor the team, set strategy so it's more sustainable, the solutions we'd leave behind. And then I wanted to tech enable that firm. My partners didn't. I had grown that to a partnership with 6 other fellas. So I sold that organization to them and threw in with another partner and started writing some technology. And spent about 8 years doing that. When I was getting ready to sell out of that business, Lou called from Trinity and asked if I'd be interested in coming back.
Excellent, you said, right?
Yeah. We had stayed in touch, obviously, over the years, and my wife gave me 6 months. After being an entrepreneur for 15 years, going back and working for the man, she said, "Yeah, you're not going to make it." And it's been 10 years. I just got a note today, my 10-year anniversary.
Wow.
That's impressive. And to your point, I've just my own experience in talking to others. When you are your own boss, when you do your own thing, it is a difficult transition to go back. So, well done on the powers that be that allow you to do that, and also just for you to kind of fitting in that mold and that role.
Yeah, and the and kudos to Trinity, right? Because if I was not able to be entrepreneurial, and what I've learned about myself through my various iterations in my professional life is that I'm a builder. I'm a miserable entrepreneur. I started and sold a couple of successful companies, but when they started to grow and it was time to start focusing on quarter-over-quarter earnings, it's like, yeah, okay, next. I didn't hang around to make the big money because I loved building, right? And once I got it built and it was ready for sale, I begged off and went and started building somewhere else.
But let me just jump in the right fast there, Gary. But doesn't that make you a much better supply chain executive and leader because you've had that background? Because I find that so many leaders in supply chain, not so many, but some are just kind of like there. They're just going through the motions. But I love someone that's a builder who wants to create and wants to always innovate.
Yeah, and it also, to kind of bring us back to topic here, it also motivates me to continue to learn because there's all these things to learn about to apply to whatever I happen to be building, right? Whatever innovation we're working on. And then I went back late in my career and got my master's degree in supply chain from Michigan State University, which is one of the top supply chain schools year over year. And as I was studying supply chain there, it's like, that's not what we're doing. That's not what we do in healthcare, right? All these technical capabilities and approaches and ways to engage suppliers and talk about trade relationship efficiencies and all this stuff. It's like, yeah, I don't hear us doing that in our industry. So that really started me on this path to engage in more meaningful ways with university to get some of that kind of thinking, that kind of talent into our industry.
Well, Ed, hats off to you. I just want to comment. He bleeds mission. I mean, Ed wouldn't be doing this if he wanted to build a better future for us. So I love hearing it. And you talk about mission. Ed, I really, really value what you've said and can totally feel it in your voice and exactly where you want to go with this. So hats off to you.
Yeah. One of the things I tend not to share outright when I talk about my career is kind of that underlying motivator, right? We all have them. And to your point, Gary, about mission, I've got a personal mission and passion. I had a stroke when I was 25, a TIA, actually. I was a big weightlifter and walked out of the weight room, our spare bedroom that was my weight room at the time, and I couldn't speak. My brain told my mouth just how to form words, but they were not coming out anymore. I didn't work, and I was trapped in this body that couldn't speak. So it's been a heck of a motivator in my life and in my career to continue to give to this industry that helped me come back from that experience,
Yeah, it's such a young age too. I mean, you're still living in the invincible years at that point. So like that's quite a shock, I think, to you. It's like, how could that possibly happen? And so I can see where your passion for the industry, comes along, and
Personal reflection.
Honestly, yeah. And if anybody's like really curious about how you've innovated within your current role, just go listen to the first podcast about how you partnered with Medtronic, because that is absolutely an example of innovating even though you're working in a large organization. And I think our topic for today is another way that you've fueled your entrepreneurial spirit, because I know you've been so involved in the industry, even outside of your work with Trinity, is things like this. Although this is both. This is something that you've done within Trinity that you're also building to share with the industry at large, which is, how do we start to engage these students that are in supply chain programs and expose them to healthcare? And I think you said it really well. You went to one of the top supply chain schools, and everything you were learning was like, this isn't what we do in healthcare. And so I feel like there's also kind of like a gap in student exposure to healthcare in terms of like how it really is. Can you walk us into how you started engaging students and universities to start building a pipeline? How did that even begin to happen?
Yeah, it really started as kind of a stereotypical building a pipeline, right? So getting engaged with universities and trying to inspire students to consider healthcare as a destination, right? As a career path. And it started doing some guest lectures for professors that I studied under at Michigan State. They'd have me come back every semester, and I'd kind of evangelize about healthcare is a really good place. We need talent like you are learning here at the university. We need that talent. So try and get kids interested to come into our industry. And I got so much value from doing some of those guest lectures, and then I started doing case studies where I'd be a judge for kids that were competing for case competitions. And then I started to share that with some of my peers and some of my team here at Trinity. And pretty soon they were asking, hey, can I go do one of those guest lectures? Or can I sit with you on that case competition? And now we find ourselves, our supply chain at Trinity Health, we've got formal relationships with 13 different universities. And it's project work, it's guest lectures, it's case competitions, it's you name it. We are actually an entire class for this semester for a team of 4 students from NC State University right now. Their class is helping us solve a particular big data problem we have at Trinity.
And you're giving them a real problem.
Yeah, it was a real problem I had. And they're coming in helping solve it.
Sorry, Ed, is this like a senior project, like their final senior project they go through and they report out and they do like a poster session at some conference if they can, or a little more detail on that? I'm just curious.
Yeah, so it's under Dr. Rob Hanfield, who did a lot of work during COVID in our industry, and he's a supply chain professor there at NC State. I met him at a conference. We struck up a conversation about this notion I have around supply chains run on a bill of materials. We have that in our industry. It's just we don't have it in a way that's really actionable. And so to use some of that technical wherewithal that you learned in supply chain schools, you kind of are acting on this bill of materials that we don't have visibility to. So when we started rolling out our EMR here across all of Trinity Health, a standard instance across the whole enterprise, I put my foot in the door and said, hey, I'll master the supply data for you if you scan in all the procedural areas. So I'm mastering that data, feeding it to Epic, and the teams in each of our procedural areas are scanning all of those supplies now, building me what I've coined a patient bill of materials, right? So for every procedure, I have a bill of materials now that was consumed and that can be reposited for us to do analytics around, for us to make sure that that supply that you're scanning isn't already expired, hasn't been recalled, it's safer for the patient, right? All of that goodness that comes from that event. But now we've got about 70% of my enterprise up on this version of Epic in our instance of an EMR. And I've got a lot of data that they've scanned in all those procedures in all of those cath labs, EP labs, ORs across 70% of our 101 hospitals, right? So it's a big data problem.
The visibility of being able to see this, Ed, is huge. And I would like another hour after this podcast to talk to you about it, please. Please.
Yeah,
I don't want to go into the weeds too deep, but man, what a great plan.
Yeah.
Are you leveraging AI then?
Well, I'm leveraging whatever technology those students have learned that is helping us to handle this big data problem. So the problem that they came in with, and it sounds like I'm setting up a joke, a supply chain major.
By the way, we're recording this on April 1st, so Ed, feel free to set up the joke.
Yeah, so a supply chain major, 2 engineers, and a data scientist walk into Trinity Health, right? But these 4 students with varied backgrounds and varied wherewithal, as I worked with Dr. Hanfield and his team, they kind of picked these students as having the right expertise to solve this problem that we had described. And they're helping us by taking these data, working those data, and helping us understand exactly how complete and accurate, testing the data from a bunch of different perspectives, readying us to utilize those data for some of the use cases that we've contemplated. So yeah, and we are, what Rob and his team do is take the learnings that these students will acquire through solving this problem for us and turn that into the appropriate curricula for a particular class. And then we become their class for this semester. And at the other end, they're doing a presentation and a readout to us on the learnings and how we can take next steps with it. So it's a really good program.
Are there a few things that you really want to receive from them? Do you already know? In other words, like, I really would like to have these actionable steps from this. I mean, you're giving them some direction, I'm guessing.
Yeah. We had to set up and built a charter statement, and it was iterative because that too was part of the learning. You know, for them to come in, interview us, what's your problem? Why can't you do something about this yourself? What don't you know? What do you wish you knew, right? So they're asking these questions, and we iterated around a charter statement for them for the class. And then, you know, it culminates in 2 different use cases that we're hoping to get out of this. And with full acknowledgement that they may find that the data is not at a level of quality that we can fulfill one of those use cases, right? So that's just part of the discovery and part of the learning, but it's also real. I mean, it's what these students will face when they get out into the real world.
And last question about this, for me anyway, are the students on site with you guys, or are they all remote?
No, there's only actually one on campus.
Okay.
So the students are all remote to us.
Right.
And 3 of the 4 are remote to NC State. So
okay. All right.
Yeah, it's very virtual.
Yeah, exactly. But what a huge advantage to have super smart, motivated individuals that want to help. I mean, this is fantastic.
Yeah. And one of the biggest challenges for anybody else thinking about doing such a thing is we really need a glossary of terms. I mean, we talk acronyms and
all day long.
Very familiar with our own language. And boy, that's been an impedance. That's something we spend a lot of time just teaching them. And it's embedded in the language that's in our data, as well as the way we communicate with one another verbally. So that's been a big challenge for us, actually.
It's also interesting that you're pulling people in, or students specifically in, that are from different degree programs. Like you said, hey, 2 engineers and a data scientist, right? So it's not just pulling people in from supply chain degree programs coming into healthcare supply chain. It's sort of like bringing in roles that are starting to form as part of a strategic supply chain kind of approach and building them into what that might look like in the future. Because I think sometimes a lot of organizations are sort of saying, hey, you're our supply chain person who's really good with data, so we're going to make you our data analyst. And what I kind of like is you're actually creating a pathway in for people with these other degrees who are actually getting formal training in how to solve some of these problems through methodologies that maybe supply chain degree programs don't even have incorporated, right?
Right. Yeah. Yep. And two industrial engineers, a data scientist, and one that is he'll have his master's in supply chain here in the next coming months. So they're all getting ready to graduate.
So the student with the supply chain degree program is actually learning how to find people in areas of expertise and exactly how they might fit into a strategic sourcing concept as well, right? Like, isn't that part of it? Is team building with all this different experience?
Yeah, it is. And learning to leverage each other's expertise, right? So the supply chain person can bring a context to what's he talking about this bill of materials? What does he want that for? What does that mean, right? And he'll provide a context from his learnings and help them understand, oh, this is a perspective we're going to need on that data then, right? This is what he means by completeness or accuracy, because a bill of materials must have these criteria to be useful, right? So they all, you're right, they all play a role. And the fact that they curated this team for us to solve a very specific problem was just fascinating to me.
All right, let me throw a quick question in there. Obviously you guys are huge. You have a big footprint, a lot of geography. Not everybody has that, right? There's the 150 bed guy out there who would love to have some quality talent. Can that facility garner somebody a relationship with a university like this to go get some talent? Maybe not 4 at a time or 10 at a time, but is there a way to do that?
Yeah. There's been very specific projects at some of our ministries or at the system office around a very narrow function where we've just engaged students to come in and help with a project. And they might be an intern for the summer. That's pretty popular. One thing we just did recently, we installed a new contract lifecycle management application. And what's the last thing to do with software before you pay the last tranche to the supplier? You go through user acceptance training or testing. We went through UAT and we thought, well, why don't we bring some more bodies in to test this software? So we had 8 or 10 students from 2 different universities come in and very naively start going through scripts and working the software. And we felt like we had a really thorough test of that software before we took it over. Because it wasn't just us seeing it for the narrow way we intend to use it. It was somebody brand new to the industry, to the application, trying to get things out of the system. So we really thoroughly tested it, and it was an interesting way for the students to just peel out of class for a couple of days and help us with that problem and learn a little bit about how we view contracts, how we handle contracts within the healthcare industry. So
that's a great use case. And generally, do you think or do you find that some of these universities are actively, they want projects like this? They're actually trying to go out and solicit?
Yeah. Yep, absolutely. So currency at a university is really twofold. It's getting those students employed, gainfully employed, right, in their chosen discipline at the end of their journey. And then the other thing is research and publishable research. So to the extent that you have a problem that needs some research applied, I actually, a year or so ago, helped to sponsor a PhD student getting his PhD in supply chain. We provided some content and access to some of our facilities and processes, and he wrote a dissertation in part around problems that we were working to solve in our organization. And I was asked to sit in on the dissertation. So they went around the room and introduced Dr. Ed, Dr. Right? But it was fascinating to me. And we just provided a context for that research and now published paper. And then with a couple of my other peers, we've stood up a little kind of a think tank, but we engaged another professor who was acting as a convener for us. And when we get off and start doing some experiments, they'll actually document them in hopes that there might be something publishable. We hope that there's something publishable because now whatever worked and whatever didn't work is now going to be public domain. So all of our peers can consume that research and use it, right? If we land on some solutions as we do some experiments. So a lot of different ways to bring universities to the table, but they are motivated, thinking that they might get some research out of it, publishable research, and that there'll be a place for these students at the end of their collegiate journey.
Well, and speaking of that on a pipeline, have you found that you've been able to hire some of those, and or maybe not only you, but have they gone into healthcare because of the experiences they've had with you guys?
Yeah, there's 3 people that we've brought in that I've been a preceptor for in a management fellowship program, that they spent a year with us and ended up working in our supply chain here. One of the ladies that's coming in to be precepted next year, I met her through a university here in town, and she expressed an interest, had some initiative, applied for the fellowship and got it. So I expect she'll find herself employed in one of our facilities. And what's really fascinating, we haven't even touched on it yet, but this whole notion of these case competitions, I really do think we're onto something. And as I get ready to retire here in the coming months, I'm going to put some energy into this in support of the ARM and the ARM chapters. We just held our 2nd annual healthcare supply chain case competition in Michigan.
And what are case competitions? You're like, you could be a podcast host, Ed. Those are the 2 things I was like heading to, was like, what is a case competition? Because I don't think many people that are listening have any idea what that is.
I didn't know what it was. I never participated in one of those in my collegiate career. But what they are is universities have budgets typically set aside to take some number of students off campus to go compete against other students from other universities to solve a business problem. The business problem is written up. The students get that problem statement at some point. I mean, some of these case competitions, I judged one about a month ago where the students literally got the case 24 hours before they had to present to us judges. So these kids hadn't slept, right? And the one that we did here in Michigan, it was a pretty complex case. So we sent that to the students a month ahead of time. And they spent some time working up solutions and actually building out their presentation. So it varies. But
are these real cases too? Like they're real problems, or like what you were talking about, how you engaged NC State, or are they kind of like pre-manufactured?
No, well, I think outside of what we're doing, some of them are, case studies that were done at a university studying what 3M did with, how they met the demand for N95 masks, right? So where they might strip some of the actual results out and present that case. But what we're doing is presenting real problems. The first one we did, one of my peers in the state, he had a warehouse this side of COVID trying to figure out what to do with it, and created a case around what should this health system do with this warehouse? Should they continue to lease it? What's the value in leasing that, right? So provide some data, and the students came up with some solutions. This one, I'm engaged with an organization in the state of Michigan to improve our disaster preparedness here in Michigan. And our entire conference for the day was themed around disaster preparedness. So I wrote a case that kind of outlined what should the state of Michigan do with their repository of items around the state, and each of the hospitals having some number of items that they're going to use for disaster preparedness. How do we avoid expiry? How do we make sure we coordinate and communicate around the most efficient use of keeping an appropriate stockpile at the ready? So we wrote that case. We had the state of Michigan, and we had some of my peers do a little session later on in the day where we tabletop the exercise. So it was part of the whole theme. And one of the things that's interesting and really motivating for the universities is these students, typically they go to these case competitions and they present to 3 or 4 judges. And the judges are other professors from university. When they come to a Michigan ARM event, they're presenting, and in this case, they presented to 140 potential employers. So we held it at one of our conferences. There was a panel of judges up on the stage with them. But these students all got to sit there in the morning, we run it, and they got to present in front of 140 potential employers or people they can go intern with for this summer. And then they sat through the entire day of conference, and we announced the winner at the very end. So they got all that time networking and learning and participating in other sessions. Terribly valuable. And the universities love it from that perspective, that all these employers are sitting out there in the audience.
It's funny because last year's theme for ARM was reimagining ARM. And like, it's interesting how you took that theme and started to reimagine what the ARM chapter or the regional chapter could mean for the community and these students that you're engaging. And like, that's like kind of taking that ARM chapter and really injecting some serious purpose into like just how it functions, not as a chapter, but as a regional asset.
Yeah. And, another thing I've found is the other side of COVID, I'd sit down next to somebody on an airplane and have to spend 10 minutes describing what healthcare supply chain is. People just didn't understand what I did for a living. Of course, this side of COVID, everybody knows what I do for a living, and they've got a media-informed opinion of whether I do it well or not. Right?
Yeah.
So, but what has also happened over that period of time is more and more universities have launched supply chain programs. And now they find themselves trying to find a niche. And shame on us if we don't line right up and get to that table and say, all right, here's a niche. You can do some study. Our industry needs some help. We need some of that expertise applied. And I think there's an appetite out there amongst universities to find a place for their research, for their students, and build up kind of a capability in healthcare specifically. So there's a demand there that we can fulfill.
Yeah, every hospital out there ought to be raising their hand and saying, I need some help. I need to bring some of these really motivated young individuals in to help. Because honestly, it takes me back I guess it was about 2 years ago at our supply chain meeting. We had a whole room of probably 40 supply chain execs. You were in there. And the theme that particular day just transpired to, what are we going to do? Because we're all getting old. And we've got to bring new talented people into our profession. And that was literally, everybody talked about it for probably an hour probably that morning. And this is a good way to do that. Not only get the great horsepower right there when you need it, when they're in school, but also hopefully it brings them in and they ultimately, take over some of these roles in the coming years.
Yeah, absolutely. And like Justin mentioned earlier, I followed this experience for this case competition here in Michigan, kind of followed it all the way through and captured all the documents and documented the amount of time it took for each step. And I'm turning that into a playbook. And I've got several other state chapters that are going to take that and work with universities in their locale. And I've really got this vision and hope that perhaps we could turn this into do a bunch of the winners from the states go to a regional or, have our own NCAA tournament, right? And culminate with a presentation between the top few schools at the National ARM Conference.
I love it. Supply chain madness. So not only are we recording this right in the middle, right on April Fool's, but we're also right in the middle of the bracket. So, but I do love that. I think there's also some pride to be had from the universities. Like, I mean, let's be real. Competition, especially at the collegiate level, breeds an enormous amount of innovation because, people love to compete and prove themselves. Hayes knows he's the biggest college sports fan I know. Him and our producer Aaron get into it all the time. Like, well, hey, I can see these students, try to compete for the pride of their university.
Throw a little NIL money in there, transfer portal too, and we could probably get some really good competition here. And to your point, I think if you did, East versus West, maybe I think you would create a lot of good buzz. So I like your idea.
I'm just saying, I just looked it up. Gonzaga does have a program, so we could be competing from out here in the Northwest. You guys are talking about all these giant schools where you're from. I'm out here in rural health Northwest world on public health districts, critical access, and some systems that do have some presence out here. But I bet you we get Gonzaga on that list. I'm just going to throw it out a little bit.
Yeah, and it's interesting. It's pretty easy to find who to talk to at a university.
Yeah, for sure.
they list the programs they have, who the chair of the department is, and oftentimes right down to, a specialty, right? So you can find Professor Kevin Kettles at Wayne State University on their website as somebody that's interested in healthcare supply chain.
No, Ed, I was just thinking about this too. The foundation boards, that sit on these foundation boards. I sat at my alma mater for 13 years, and they're always looking for opportunities to breed that and make it better. And they direct a lot of that traffic. So I'm thinking about the wealth of where this could go. And, you sharing this information on public domain, which is another piece of it. I'm just really curious to see where this goes, because I think we could have a bracket 64 teams and make this happen. I really think we could make this happen. This is exciting.
I just want to get everybody filling out the brackets. I want to have the power supply. The brackets going.
Maybe we're hosting the bracket, Ed. Ed, when you retire, maybe power supply. Yeah, power supply is hosting. There we go.
Oh, very
honestly.
Good.
We could cover it like March Madness here at
Game
Power
on.
Supply. We could definitely put a lot behind it, get really creative with it. It's interesting, Ed. I live in the backyard of Penn State, which has a great supply chain program. But to the earlier point about different degrees getting involved, I was with the local health system recently and talking to somebody who just graduated from Penn State 5 years ago, and she's she's in a supply chain role. And I was like, oh, did you go to the supply chain program at Penn State? When she told me she graduated from there, she's like, no, I was in hospitality. And I think, we've had this age old sort of conversation in supply chain. It's like, how did you get into supply chain? Oh, I fell into it. I was in clinical engineering. I was in, and we have all these different backgrounds. And so I think, it's great that we're getting more of these supply chain programs popping up, but I also like how you're bringing in the universities to say, here's the problem. And then they just find the right mix of experience to pull in. And you never know, they might end up in supply chain and provide a really unique niche of perspective into that. I think the last thing I kind of want to end on this and any additional thoughts that everybody has, but when you talked about, I can get on a plane and sit next to somebody and everybody seems to know what I do for a living. I still want to say they still only understand what you do for a living from the maybe more of the Walton School of Business or Walmart type of supply chain. They don't necessarily understand healthcare supply chain. And there's a lot of those students who understand supply chain. But like you said, there's a lot of concepts that don't apply in healthcare. How do these students become advocates for the healthcare supply chain after you give them some exposure and then they go back to their universities?
I think what I've seen, it's really twofold. One, and shame on us if we fail to do it, but we really do speak to kind of this generation with the very purposeful work that we perform, right? So to think that I could have a career in something as purposeful as helping my fellow human beings' health and well-being, right? That's very motivating. So that inspires students to go back and talk it up. And the other thing is just the amount of help and kind of how greenfield we are in healthcare, right? Because our industry kind of grew up in the day and age and with incentives that motivated not much investment in back office, right? If it cost us $1, somebody reimbursed us $1 and a nickel back in the day. Now they're only giving us 60 cents. So we got some things to figure out, right? But we didn't invest in systems, supply chain in particular, that other industries have been forced to invest in to stay up with the competition, right? So we're pretty greenfield in terms of what we need from a supply chain perspective. And for students that have that initiative, they see all of that opportunity. And you can do it in a very purposeful way. So those are the things that I've seen kind of resonate with students as they get back to their university and get excited about thinking about healthcare. Here in southeastern Michigan, I've had students that, have been part of a program or part of a guest lecture or something that I've been, or a student case competition, and they spin out and go work for a tier 1 supplier in automotive, only to call me a year later and say, you know what? this doesn't feel like what I want to do the rest of my life. Can we talk about maybe some opportunity in your shop, right? So, yeah.
Those are great conversations to have there.
Yeah. Yep.
All right, Ed, anything you want to add? I mean, you just bring so much to the table every time you hop on the show. I love what you're contributing to the industry. I didn't realize there was a whole backstory conversation at one of Hayes' events years ago that maybe spawned some of this. So that's cool connecting the dots there, Hayes. But anything that we should really emphasize or add before we wrap up?
I would just, call out to my peers and to the supplier community as well, right? Get engaged with the local chapters or with ARM National and get engaged with universities. And I think I really do think we're onto something here that will be a nice feeder from a talent perspective, really help our industry out. And like I said, it's been really, really popular with my young professionals here on my team, because they love going back to university, and now they're the expert at the front of the class giving a guest lecture or judging
Exactly.
a case competition. So it's been a really strong retention strategy for me as well, actually.
That's great.
Well, you're going to have this playbook. We're going to do everything we can at Power Supply to help increase and promote it. But if there's somebody out there who's listening who's not active with their regional ARM chapter, this is going to be made available to all the state chapters. It's a great reason for you to get involved. And if you believe in sort of the mission and purpose behind what Ed's putting together, maybe you could be the champion that helps drive this forward for your regional ARM chapter and get value for your organization and build your pipeline as well. So just going to put that plug in there for you, Ed. I know this is all rolling out really soon, and fantastic contributions to the future of healthcare supply chain. Thanks again so much for coming on the show.
All right. Thank you.
That was Ed Hisscock, Senior Vice President of Supply Chain at Trinity Health. What just great work. And I know it's helping Trinity, and I know it's helping the universities, but really, Hayes, this is just really helping the industry and helping to improve the industry. I love the fact that this playbook is going to be coming out because that's something that can be sustained. It's not something that one person's trying to accomplish independently. This is something that people could take that playbook at their ARM chapters and roll it out and make sure that the work continues.
Yes, and I hope everybody does reach out to get that playbook, because I think it's going to be very, very valuable. But Ed, I love Ed. He's literally leaving a stamp, a legacy on not only just for his health system, but for every health system out there. So a wonderful job. Love him, love what his mission is. So really enjoyed the podcast today.
Yeah, he's got a big, sincere heart, and he puts it into everything he does with his work. So, Ed, great job on the podcast today. It was great to have you. And to everybody out there, on behalf of Hayes, Gary, and myself, thanks for listening to this episode of Power Supply.
Thank you for listening to this week's episode of Power Supply. As a reminder, you can help support us by subscribing on your favorite podcast app or by downloading the smartphone app on your iPhone or Android. Simply search for Power Supply in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@powersupplymedia.net. We look forward to hearing from you.